My friend sees me because of how I sound when I speak.
This is 15-year-old Juliet Kwenu, who has been battling stigma due to the defect on her voice.
I don't get closer to them when they are playing because they will make fun of me.
She was born with a cleft palate and had a surgery done when she turned 6 to correct the condition. But as she grew, the repaired split in the upper roof of her mouth reopened, disallowing her to speak properly. She sounds nasal and is unable to audibly pronounce words.
I want to have my surgery done to correct my speech so I can play with my friends.
Juliet's father, Peter Kwenu, who has been her daughter's comforter over the years, says it hasn't been easy.
She complains to me whenever she returns from school that her colleagues make fun of her condition, so I had to inform a teacher to keep an eye on her.
Juliet and her father came to the Kolebu Teaching Hospital to visit a team of doctors with hopes of correcting her condition. A number of surgeons and health experts from across the world have arrived in Ghana to perform free surgeries on hundreds of children with cleft lip and palates, a mission-themed Operation Smile. Before surgeries are performed, each child must go through a rigorous screening process.
And you say, puppy, puppy, puppy.
Puppy, puppy, puppy.
So when he does talk, it sounds more puppy, 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 because the air is coming through the hole and at the back.
Although Juliet feels nervous about her operation, she is happy she finally gets to sound normal after the surgery. Juliet's surgeon, Paul Skoll, is ready to head to the theater.
She has a moderate-sized defect of the front of her palate, just where the teeth would be, sort of in what we call the alveolus. And what's happening is when she speaks, some air goes through that hole in the palate and comes out through her nose, so the speech isn't perfectly normal. And what we plan to do in the operation, which may take an hour or a little more than an hour, hopefully, is we're going to move some tissues into that defect, into that hole, which we call a fistula. And if we close that hole and everything heals up beautifully, as we hope it will, she should have absolutely normal speech within a very short space of time.
It is estimated globally that out of every 1,000 childbirths, one child is likely to be born with cleft lip and palate. Usually when these kids are born, they undergo surgery to correct the condition, but they do not get to sound better after. Doctors from Operation Smile South Africa have collaborated with doctors here at the Kolebu Teaching Hospital to conduct a surgery on some of these children to correct their speech, just as they are doing to Juliet. Hopefully she gets to sound better a few weeks after the surgery. Within 2 hours, the surgery on Juliet's defect was done and neatly stitched.
It went quite well. It actually went a little better than I thought it would go. We managed to take some tissue from the inside of the lip where there was a little bit of extra and turn it over to fill the defect. And if that heals nicely, and it's if, because there's still the possibility of infection, of bleeding, various other things can happen in the post-operative period. But if that heals, as I hope it will, then she should have perfectly normal speech.
Cleft lip and cleft palate are openings or splits in either the upper lip or the roof of the mouth, which occurs when facial structures that are developing in an unborn baby do not close properly. The Chief Executive Officer of the Kolebu Teaching Hospital, Opokuwari Mpoma, said birth defects like cleft lip and palate can happen for many reasons, as they sometimes happen because of the mother's exposure to certain things while pregnant. He advised women to avoid the intake of alcohol and smoking during pregnancy.
He advised that pregnant women should, women who are in a fertile age who know that they could get pregnant at any time, they should make sure they eat well, exercise well, and avoid smoking, alcohol, and then some of these medications. In fact, there are all sorts of unauthorized or unverified preparations that people take, and some of these have very harmful substances that can harm a developing baby.
The Operation Smile team says it will not relent on its efforts to continuously create access to proper healthcare solutions for children born with defects such as cleft lip and palate. Alekemi Nyavo is the Ghana country manager of the Operation Smile.
Patients who are born with cleft lip and cleft palate, it's a difficult situation for them because of the conditions they are in. Usually they are stigmatized against because people don't know the exact cause for cleft and the fact that there is remedy. And so we are creating this awareness to make people aware that it is possible to have a child that may have this condition, but there is surgery, quality surgery that is available here in Ghana.
Thanks to free health missions like Operation Smile, these surgeries have been conducted freely on hundreds of Ghanaian children, including 15-year-old Juliet Kwenu, whose smile would have been stolen by the defects. Juliet has finally been brought into the plastic surgery intensive care unit to be monitored. From here, she will be moved to her ward until she gets better. My name is Godwin Asideba reporting for GH1 News.